diagnosed with a very rare vasculitis disease, which is fatal if it's not treated properly. And I've always worked very hard. I continued to work, even sick, to try to continue my group health coverage, but was finally ordered to stop working. And as a result, I lost my group health coverage. Was able to get TennCare for a short period of time until my disability kicked in through my job, and they've also kicked me off of TennCare. So now, I'm over the income limit for TennCare, but I don't make enough to even cover my medications and my treatments each month, much less my living expenses. And I'm a little confused as to what you plan on doing for that. Y'all keep saying it's not a partisan issue, but the Republicans were in office for 8 years and didn't do anything for health care. And now it seems like we're just trying to oppose what the Democrats are putting out there, but I don't understand what you guys are planning on doing for people like me. Right now, not in a few years, but right now.
This Republican wasn't there. And I will also tell you that in the current bill that we've got on the floor of the House, you would fit perfectly in there. You would get either if you got to work again, hopefully you'll get well enough you can. Well, I'm not sure what you have.
No, it's
vasculitis you have, but if you did or didn't, let's say you didn't have that, you'd still get a tax credit or just a voucher to go purchase health insurance. And why should you be treated differently? And that's up to 200% of the poverty level. That's $44,000 a year as a family. And why should you be treated any differently with TennCare, which has very decreased access, as you well know? Why shouldn't you have the same access as I would have? You should. And that's the way you can do it. That's what we've got proposed right now.
Okay, real quickly, but I'm considered uninsurable by any private insurance.
No.
But your $5,000, I don't understand your $5,000 voucher because, I mean, one visit to the doctor is $5,000 for me.
No, you're missing what I'm saying is you take the money and you own your own health insurance. You own it. It's not a $5,000 a year through, that's all the money you can spend. And with pre-existing conditions, you're the very person that I started off by saying about what? We've got to eliminate pre-existing conditions. And how do you spread that risk? If you had an associated health plan across state lines, guess what you can do? You can pool all the realtors in America, which would be 500,000 or 1 million. Yes, you would pay a lot less. I, at my age, if I'm a realtor, would pay a little more. But you'd be able to afford health insurance that way with your
So is that not government regulation that y'all are speaking out against now?
No, it's not government regulation. No, it's not. It's individual choice. You can go pick where you buy that, not the government. And you would be able to do that.
Regulated to make me insurable.
How are you supposed to pay for the vouchers?
Regulated to make me insurable.
No, what you do is when you look, the reason you're uninsurable as an individual when you go out, you're going to cost $50,000 a year. You can't afford that. The insurance company was to go out of business. I'll give you an example in a minute ago why this health star is not going to work. You need to pool your risk with thousands of other people so that you pay a little bit more. I mean, I pay a little bit more because of my age. Right now, at my age, if you were perfectly healthy, I would pay 4 or 5 to 1 of what you would pay for health insurance if I went out on the market. Well, we need to make it a little more affordable for the person who's 60 and just lost their job, and a little more affordable for you or findable when you are uninsurable. The other thing you can do, very simply, we've got in our bill, is to create a state high-risk pool. It's then subsidized by federal tax dollars, who now are paying for Medicaid and Medicare. You go in this pool, you then will be eligible for health insurance. That's how you do it.
So you'd regulate health care. Okay, thank you.